Hi, I'm glad that you stayed around for our second half. We're going to talk about some veterinary medicine this time. Dr. Nelson, I know that one time when I talked to Dr. Chaing before, she said that one of your pet peeves or something that you're very passionate about is pet obesity. So you want to talk about that a little bit?
Well, I think it's something that's been ignored in human medicine for a long time, and now we've learned in the past 10 years or so just exactly how detrimental it can be to our health. And when we hear that 60-some-odd% of adults in the U.S. are overweight or obese, it really brings into perspective the healthcare costs and the things that we're seeing now. Then you look at our animal population, and the statistics are that 40-some-odd% of pets are overweight. 47%, I believe,
really?
Is the statistic. But honestly, I feel like that's grossly untrue. I feel like that there is a tremendous amount more than 47% that we see in our area. Perhaps in, rural United States that may be true, but in this area it's definitely the dog that is nice and slim and trim is the exception to the rule today.
Is it because of our affluence and then our enjoyment of food that we have a hard time denying? I mean, because it's easy to put a pet on a diet. Much easier than
you would think. You would think. It's actually a little bit more difficult than you would think, because there's a whole cascade that occurs whenever an animal or a person becomes overweight. It's sort of a self-perpetuating cycle within the body. We think of fat as being a storage facility, essentially, but what we've learned more and more about is that it's actually a hormone factory. So it's producing just oodles of things in our system that encourage inflammation and cancer and heart disease and any number of things. It's an absolute hormone factory. So the fact that it's sitting there in our system and we say, okay, well, I'm just going to feed him a little bit less, he'll lose weight. It's not necessarily true, and actually only about 8% of owners that try to do it on their own actually succeed. So
what is the way to do it then?
The way to do it is to go to your veterinarian and to sit down and talk about this realistically. Don't take it personally when your veterinarian tells you that your animal is overweight. Even if you're overweight yourself, don't take it personally, because this is about what's best for the health of your dog, and that's what we as a veterinarian are responsible for telling you about, is telling you what's best for that pet and what's going to make that pet live a long, happy, healthy life. And just like we don't see obese 85-year-old people, we're not going to see obese old dogs or cats. We're not. The ones that live to 14, 15, 16, 17 years old are the skinny little crunchy ones, and it's because they've never had to fight the battle of obesity. So prevention is key. As with just about any other disease process that there is, prevention is key. And so starting when they're young, we all think that fat puppies are cute. They're not. That is just like childhood obesity is what you're looking at, and you need to view it that way. It is a serious health crisis, and you need to be talking to your veterinarian about how much do I feed, how much do I walk, how much can I treat? Is treating important to you? Okay, we need to figure out a way for you to do that, because we still want you to feel like you're loving and treating your pet the way that you want to, but you need to be doing it in a way that's not killing them with kindness.
Are you writing some articles? You're such a good advocate for this. The way you just expressed it to us here, it was just wonderful. Are you getting that out to a lot of?
I'm trying. I'm trying really hard. I am Dr. Arf on arf.com, if anyone wants to look at aarff.com.
Okay.
And so I do have a little forum in that way, and then also we're kind of, launching this media aspect of my career a little bit more, and so I'm hoping to be able to get the message out that way as well.
Yeah, because then your message, because you've just taken the time to become a specialist in acupuncture treatment. So tell us about that.
This is my new obsession.
I love, and by the way, I've had acupuncture with a Vietnamese doctor, and I would have it every week if I could. I'm serious.
I hear that a lot, actually.
I would.
It's wonderful.
That's been a really nice way to segue into veterinary acupuncture, is the fact that human acupuncture in the West, in the United States, has seen such an upswing in the last couple of decades. So we're now starting to see the same pattern with our animals. And I get that a lot. I get a lot of people who say, oh, I've had acupuncture. I've had the experience. I've seen how it benefits me, so I want to have the same thing for my pet. I want to do a better job of providing them the medical care and the health benefits that they really need. What I love about it is that there's nothing mystical about it. It's not this strange, far out
voodoo
Eastern concept. It's really based on literally several thousand years of observation, of looking at what keeps a person healthy. So the basis of acupuncture stems from traditional Chinese medicine. And from that grew acupuncture, herbal therapy, ways of looking at our food and our lifestyle. So it really is a holistic approach. But now we can take all of that and fit it into all the good Western treatments that we have too. You can't replace surgery. You can't replace antibiotics. You can't replace these really extremely useful and amazing things that we've discovered in the last century, but you can put the two together. And that's what I'm really learning now, and it's wonderful. I have several clients already who we've just started with, and with their commitment, and they're allowing me to learn a bit with them and on their animals, and we're really starting to see
what are you treating?
Really, a lot more than I ever expected.
But I mean, what are some of the ailments that
I think
are responsive to this?
One of the things that most people can readily relate to is pain. So simple things like arthritis, post-op pain, anyone who's ever had orthopedic surgery. People or animals, knee surgery, for example, ways to get you back to health sooner. It gets you off of drugs sooner so that you can have a better, what we usually like to say, a more natural way of healing, so that you don't feel the pain, but you don't have to be on loads of medications just so that you can function and walk. So I think pain is one very easy aspect that everyone can grasp onto. Beyond that, we found that it is really beneficial for some of our very frustrating chronic diseases. In veterinary medicine, skin disease is one of those.
Yeah, the hot spots where the itching and the hair comes off.
Absolutely. We have so many clients who are frustrated with years of trying to deal with these allergies and skin infections, ear infections, and all these things in their pets. And the idea is, instead of just giving them more medications, and trying to treat the symptoms, if we go from a Chinese medicine approach, an acupuncture, and herbal approach, you're treating the root of the problem. What's wrong with the pet? Why are they off balance? And can we fix that so that you work from the inside out to improve things? So, you have these simple things that are like pain, and then you have these long, chronic, frustrating cases that we can help with as well.
Well, when I had it, he actually measured the energy level or the electrical. Do you do the same thing with an animal, or do you know that certain places is where effective for certain ailments?
It's really extrapolated from people, and I've had that done myself, where they hook you up, and they have computer programs now and machines where they can measure.
They actually graphed it, and they showed which ones were too high and which ones were too low.
Exactly.
And then the idea was to bring them into balance and make it hum.
Exactly.
And you do hum.
And you do. Exactly. I'm working on that myself. So they do. I think it's more difficult to take that aspect and extrapolate it to
an animal. Yeah.
Purely because we talked about they are furry. So there are physical limitations to how we can look at them and treat them. But we do have a similar approach in that we try to look at their personalities. We talk to the owners, as the owners are their voice. So we use the owners to say, what kind of personality do we have here? What are their habits? What are the things about this pet that we can look at to teach us how we can make them better? The points are all similar to where they would be in a person, and we can't talk to animals like we can a person and ask them if they feel a certain point a certain way, but over time and practical experience, we have found which points do tend to work for certain conditions.
Now, would these go down and visit the Alexandria Animal Hospital, and they'll take good care of your pet. Thank you two so much. That was great.
Thank you for having us on.
Good luck.
Thanks.